Diastasis recti. What is it, when and how does it occur, and what can we do about it? Diastasis recti is a condition that occurs when there is too much intra-abdominal pressure and your rectus abdominal muscles, which are the muscles that form your six-pack, 3 on each side, separate because of that additional pressure. So this occurs in almost all women who experience pregnancy and carry their baby full term, just because our bellies are getting so big, making room for that baby, that there's really no choice but for the abdominal muscles to kind of shift to make some more room. Women who may not experience it during pregnancy tend to experience it in the actual pushing part of labor. So all that extra internal pressure of you pushing can cause that diastasis recti to occur then. It also occurs in really heavy weightlifters. So if you see a weightlifter who's super cut, but their six-pack seems to be like weirdly far apart, that's because of diastasis recti. So they're cut, but their abdominal muscles aren't able to work together because they have separated due to the breathing exercises that some weightlifters use to try to lift heavier weights. So by doing these different breathing exercises, holding all that breath in, it creates extra pressure and causes the diastasis recti, or DR, there. It can also occur in premature babies who are born before their muscles have fully developed through their core, but that will clear itself up. It's really nothing to worry about with babies because as their muscles grow and develop, that will take care of itself. You might notice some coning or bulging either in yourself or in a premature baby, and that's a sign that diastasis recti has occurred. What can we do about it? The good news is that most of the time it clears up by itself, so really no huge concern. Most doctors don't even check for it at the 6-week postpartum checkup, usually because it solves itself. As our uterus shrinks back to its normal size, those abdominal muscles will come back. The pressure is gone, so they'll kind of resolve itself. However, in some women, that's not always the case. Some women deal with this decades after having babies and they don't even really realize it. So if you are having excess lower back pain or pain in movements, especially hinging kind of movements through your lower back, that's a sign that your abdominals, either you're not activating them correctly or that they're just not working the way they should, maybe because of DR, right? So it is something to be aware of, and it's a really good sign for yourself and your trainer to know where you are at in the recovery process. So always a good thing to kind of like check in with yourself and with your body. If you are still experiencing any kind of coning or bulging or back pain or pain during movements 6 months after your pregnancy, you want to get it checked out by your doctor. They may recommend you to go see a pelvic PT. It's always an option if you think it's going to be something that is continuing, but 6 months it hasn't cleared up, definitely go to your doctor, get it checked out. All right, so we're going to go ahead and perform the self-check here. We're going to have a seat on the ground, and you're going to lay down on your back. Now, with diastasis recti, so any woman who has experienced pregnancy and you're right after pregnancy, especially before your 6-week appointment, you may probably have some symptoms still. So you want to avoid any kind of crunching or intense core movements. So specifically with the crunching, you want to make sure when you're laying down or getting up out of bed, you do it from a side laying position first, as opposed to kind of jackknifing yourself out of bed, okay? So especially women who have had C-sections, that's really important to know. Okay, so always go ahead and lay yourself down. Side first, and then lay down on your back. So you have a line of fascia which runs from your sternum down to your pubic bone, and that is what separates your rectus abdominis, and that is what has been injured during the process of pregnancy as the internal abdominal pressure has grown, right? So we're kind of gonna check for that. What you're gonna do is you're gonna take 2 fingers and you're gonna have your palm facing you. You're gonna start up at your sternum, and you're gonna try to find that linea alba, it's called. That's the band of fascia that runs down between your abdominals. So see if you can find it. You can kind of rock your fingers side to side a little bit to make sure you're really between those two abdominals. And just work your way down to about an inch, inch and a half below your belly button. Okay, so this is just kind of for us to see where that is. The first thing we're gonna do is just take 2 fingers, you're gonna have your palm facing you. You're gonna work your way down your linea alba, which is that band of fascia I was telling you about, and just kind of check out where it is. You should be able to kind of feel both of those rectus abdominis muscles on either side of it, and work your way from your sternum down to about an inch, inch and a half below your belly button. Okay. Diastasis recti, the definition of it is that it is a separation of more than 2 fingers and is deep, not taut. Okay, so when we do this check, that's what we're looking for. We're looking for how far away are those 2 abdominal muscles. Can I fit 2 fingers, 3 fingers, 4 fingers? And is it very deep and squishy feeling, or is it pretty taut? Okay, so what we're gonna do is we're gonna lift our head about an inch off the ground, just enough to activate those muscles, but not to put too much pressure on them, right? We wanna avoid that, especially if we're dealing with DR, because it'll just make it worse in our recovery process longer, okay? So just about an inch off the ground, so they're activated, and now we'll really be able to see what's going on and where we are in terms of DR. So you should be able to feel both of those abdominal muscles, and you wanna work your way down. So we're trying to see how far apart are those 2 sets of muscles, and how deep can I push my fingers in. If that band is pretty taut, that's a great sign. That means you're on your road to recovery, nothing to worry about. If it's very deep, like you can push very deep down into that band, that is a sign that it is still very weak and it's not where it should be. Also, if it's more than 3 or 4 fingers, you need to get it checked out, okay? So we're looking for a width of about 2. 3 is okay if it's pretty taut. We can work with that, but if it's 3 and very deep or more than that, that's when you really should go check with your doctor right away. Just go ahead and work your way down. Just know it's gonna be widest around your belly button, where we were biggest through our pregnancy. If you have any questions about how to perform that diastasis recti check, go ahead and leave a comment or send me an email. My email is emily@k2fitlabs.com. I'm happy to hop on a call with you to watch you do it, give you some tips, and check in with you as you're doing it. Just remember, it's really important to be aware of what's going on in our own body. That will help us make better choices as we are on the road to recovery, making sure that we are treating our body correctly, we're supporting it so that it can then support us. All right, thank you guys and have a great day.